This conference.
Okay, so the recording is now on, and we're going to start today's conference. Today, we're going to be talking about community of practice. Now, community of practice is hopefully where you all participate and are involved in the discussion and what have you. Historically, a lot of these have been me doing most of the talking. I'd like to encourage you, if you have any input you'd like to share with the group, or have a question or a comment or concern, please just open up your mic and we'll be happy to hear from you and your, encourage your participation this morning. Um, okay, so let's go ahead and get started. If you would like to get continuing education uh, for this class, which will meet the requirements for Kern Regional Center and community care licensing for your facility. Um, you must attend the entire community of practice to obtain the credit. Uh, you must identify yourself at the beginning of the presentation on the screen or in the chat. So we want to know who is on this webinar today. And if you want the credit, you need to make yourself known. Uh, if more than one person uh, is on the screen or the telephone call, each person must identify themselves. So in other words, if there are two of you sitting at the screen, but only one name is on the screen, then we're only going to give one credit. You need to make sure everyone who is involved is on the either the screen or in the chat, so we know who we should be giving credit to. At the end of this presentation, or for the next, hopefully 30 days, we'd like you to send an email to Irene at Bakersfield ARC. And in that, we'd want the three areas that you really have learned today at this webinar. This ensures for us that we know that you were on for the whole hour. Plus, it sort of reinforces what you've learned today. So, in order to get the credit, it's not enough to just be on this uh, webinar. You also have to submit to Irene, and her address is there on the screen. The three areas that you learned today. Um, Valerie, who is also on this webinar today, is another resource you can contact, and she can give you additional information if it's necessary. And finally, we ask that if you are going to be trying to get credit for this uh, class, that you do so within the next 30 days. So that way we can keep track of who's getting credit for the courses and not have somebody come back 6 months, a year from now saying, oh, by the way, I took that class in March last year. Can I get credit for it? Get the credit now. Um, oops, didn't want to do that. All right. Coming up in the near future, some of you have heard this presentation before by me about the CQL, the Council on Quality Leadership. They're a national organization, and as part of this grant, the Department of Developmental Services and the Kern Regional Center have contracted with the Bakersfield ARC, who then contracted with me as well, to do training and provide technical assistance for providers in the community. And as part of that, we then went to the CQL and said, hey, you have a whole array of courses. Could you teach those courses to our providers? Normally, if you go onto their website and sign up for the courses, they cost $100 per course. Through our grant, you can get a 4-hour version of the course for free. So, what is upcoming in the near future? One is coming up next Thursday, not tomorrow, but a week from Thursday, on the exploring communication. And this is really helpful if you have residents in your facility or in your program who whose primary method of communicating isn't necessarily verbal. So, we don't like to use the term nonverbal anymore. We don't feel that that's a good way of really uh, talking in a person-centered manner. But for those individuals who don't use communication as their main way of communicating, this is a good course in trying to look at alternatives in communication, whether that be sort of technological equipment, adaptive equipment, just knowing sort of the cues and ways that the person communicates in a nonverbal manner. And so it will go over a number of different ways that you can work with the individuals that you serve who don't use language as their primary way of communicating. And so it's an excellent course. It's going to be available twice, one March 28th, the second time on July 9th. These are 4-hour classes. Recently, we did receive confirmation from the Kern Regional Center that they will be providing CEUs for these classes. So if you take one of these classes, you will get 4 units of credit from the Kern Regional Center for towards your continuing education requirements. On April 18th and on July 9th, we're going to be doing the 3 E's, the foundation of informed choice. Informed choice is that individuals that you serve are making decisions for themselves. And sometimes those decisions aren't necessarily what we think that we would want to do, but these are what the client's choice in regards to what they would like to do for themselves. And so we're going to talk about those in depth in these 2 dates, the April 18th and July 9th. Now, keep in mind these classes are repeats. So if you take it one time, you don't need to take it a second time. But if you take it and then decide, hey, this is great stuff, and so I'd like some of the people who work here at my facility to take this class as well, you're more than welcome to take it again for your other staff people, and they can also get continuing education credit as well. On May 14th, we're going to be doing Everyone Has Rights. Everyone Has Rights is a class
Sorry,
that is
Jeff, can I just elaborate really quick?
sure. Go ahead.
We've also had quite a bit of inquiries in regarding certain trainings because I know a lot of you have really enjoyed the trainings. So um, we cannot have multiple people on one, I guess, device, you could say, watching in because it is interactive, so it can get very confusing and so forth. We've inquired a couple of times because a couple of you have asked, so if we could just keep it to each individual person. Remember, we have 40 slots, so they can, go ahead and assign each individual can, do their own and register for that. So if we could keep it, one device per person,
Okay.
that would be great.
And that's specifically for the CQL training. For today's training and the training that ARC, Bakersfield ARC does, we can have multiple people at the site. That's not a problem. It's just the format that CQL uses is a little different, and they would prefer more interaction. Um, on May 30th and September 19th, community building connections, really talking about how, because so much of home and community based waiver is about having people part of the community. And this is really ways that you can do that and can really effectively assist the people that you serve in fully utilizing resources that are available to them within their communities. So that will be coming up on May 30th and September 19th. On June 13th, embracing the dignity of risk. This is an area that is been around for a long time, but really being stressed currently, and that is that we all take risks. When if you drove to your facility this morning or did other activities during the day, there's a certain amount of risk in all of that. We that's part of life. We do things, and that's and we there's a trade-off, and we understand that, and we make those decisions. For many of the people we served for many years, our goal was to try to keep them safe. And in doing that, in order to keep people safe, that meant, controlling the activities that they were involved with. And now what we're talking about is, wait a minute, you can make choices about the activities you want to be involved with. And sometimes those choices come with risk. So if you decide you want to start using public transportation, there's certain, risks in terms of other people on the bus. You get maybe potentially getting lost, you know, etc. So how do we mitigate those, and how do we work with the individuals in your program to make sure that their choices are being met and it's being done and as safe as a way as possible to try to minimize those risks, but knowing that we can never really fully uh, prevent risk from occurring and things happening. And then finally, on June 25th, and on September 10th, person-centered thinking. This class has been offered once before. I took it. It's a very good class. If So much of home and community-based waiver is based on the idea that you're writing plans that are based on the person. So in order to do that, you need to be thinking in terms of, wait a minute, it's not about what's best for my program, it's about what's best for the individual. Just a real quick story. A few years ago went out and did an educational program at a facility, and somebody raised their hand and said, we have Susie in our program, and Susie every day from 2 to 3 when we do a certain activity, she just doesn't participate. She seems to go off somewhere. She gets upset. She acts out. She doesn't participate, etc. What can we do to get her to involved more in our 2 to 3 class? And I sort of reframed that question and said, what can you do differently for Susie? Because clearly she's sharing with you that's not what she wants to do. So that activity is more about the facility has scheduled this activity as part of your program design, and you want everybody to come in and do that activity that you've got for this particular time. But maybe this individual doesn't want to do that activity. So how can you think for what that, and about what that person needs and wants, and develop something specifically for Susie so that 2 to 3 o'clock hour programming is based off of Susie's needs and not about your facility's needs. So this is a good class in really looking at how you can go about changing that way of thinking. Gosh, I keep adding these. Sorry about that. Okay. So what we're going to talk about today is advocacy, and there are two types of advocacy that you can be involved with basically. One is to advocate for the people that you serve, talking to folks from the regional center, at doctors' offices, if you talk to somebody from involved with government, if you're working with other agencies, how do you advocate for them? How do you make sure that other people are really understanding their needs and are really working towards their best interest? The other type of advocacy is advocacy for yourself. Uh, what's in the best interest of your facility? What do you see in terms of things that are being done at Kern Regional Center, in Sacramento, in Washington, D.C., that you would like to see different? What do you see in terms of the rates that you're paid? Do you think they're enough? Do you think you should be getting a higher rate? How would you go about advocating to see about getting a better rate for the program that you do. Finally, there's a third type of advocacy, and that's self advocacy, where you help the individual that you're serving so that they can speak up and advocate for themselves. So they can say what they like, what they don't like, what they would like to see change, and how do you go about encouraging that to develop that skill for so that people can develop that skill and be able to effectively speak up for themselves. Okay, advocacy on an individual and systems level is acting with or on behalf of an individual or group to resolve an issue. So, are you acting on this individual's needs? So, when you're going to the dentist's office, if the individual that you're serving has very specific needs or issues related to maybe sitting in the chair, allowing the dentist to go into their mouth, etc. How are you advocating to make sure that that dentist understands fully the needs of the individual that you're serving? And also, can that individual speak up for themselves and share what their concerns are about being there at the office? So that's individual advocacy. Group advocacy is more about, like I say, policies and procedures that you have to follow. And are those consistent with law or regulation? Do you feel that they're appropriate? How do you make changes to some of that? And then who do you talk to do that? What can you do at the regional center level? What can you do at the state level? What can you do at the federal level, et cetera? Um, so you want to be obtaining services and supports for people and for yourself too, for your facility. How do you do a better job of getting the things that you need to be able to operate, getting the rates that you need to operate? Uh, so we want to promote changes in practices, policies, and behaviors of third parties, of someone else. So how do we go in there and say, we need you to change the way you do things to better meet the needs of my facility and of the individuals that I serve? Advocacy is essential for promoting and protecting the civil and human rights of people with intellectual and developmental disability and for establishing, maintaining, and improving the quality of their life. So what we're talking about here is how do we make it better? Because that's what the home and community-based waiver really stresses, is that we want to make life as typical for the people that you serve as it is for you and I. And how do we go about that? And one of the ways of doing that is when things come up that really don't make a lot of sense. What's in the best interest of that individual? How do we advocate for that individual? An example, that I mentioned earlier, we're going to talk some more about dignity of risk and informed consent if you take the CQL classes. And one of the things that they stress is how do you give clients more opportunity to try new things? Well, what happens when they try new things consistent with HCBS and something bad happens? So the client gets on the bus, and so there's some stranger that annoys or molests your individual while they're sitting there on the bus. And now you're completing a special incident report that you're sending off to current and regional center and to licensing. And on the one hand, you've been told, no, let's give the client more opportunity and more chances and more individual support. And on the other hand, you're having to justify why you did that and having to answer to licensing people. And it sort of makes you feel like giving you a double message. On the one hand, let clients be more independent, but if they are independent and something happens, then you're going to have to go through a bunch of hoops. So advocacy, this would be a good example of advocacy, how some of the policies that are out there are not consistent and need to be changed to be in sync with each other. Now, advocacy is essential for promoting and protecting the civil rights and human rights of people with intellectual and developmental disability, for establishing and improving the quality of life, as I just mentioned a minute ago. And this is from the ARC, National Organization website. Now, without strong advocacy at all, levels, people with intellectual and developmental disabilities may not have access to needed supports as well as opportunity to exercise inherent civil and human rights. So we want to make sure that our individuals are treated just like anyone else. So when you see situations where they're not being treated like just like anyone else, it is incumbent upon you to speak up on their behalf, again with their permission and their involvement, and really help that individual to fully participate in community activities like anyone else. And again, also for yourselves, you're not good for the individual to serve if you're not good for yourself. So if you feel that the rates that you're getting are not keeping up with the cost of inflation and doing business, and you think you need to receive a raise, you think some of the licensing rules or some of the regional center rules uh, are not consistent with good practice for the people that you serve, speak up, let people know. Additionally, strong advocacy may be required to prevent or address abuse or neglect and exploitation that people with intellectual and developmental disabilities may be experiencing. It's important that we let people know if our clients are being abused or neglected. And just as an example, a number of years ago, I was working with a facility that would weekly give the individuals in their it was a residential facility in their residence some of their personal and incidental money, and many of them would go out to the corner store and would buy things, and then they would come back to the facility, and when the direct support professionals asked, okay, so what did you get, and how much did you spend, etc., they weren't consistent. And we quickly learned that the a clerk there at the store was shortchanging some of the individuals who didn't understand the value of money. So the facility owner and myself went down to the store, talked to the owner, and said, "Hey, you have this person working for you who is not being fair, is basically cheating the individuals that come in here, and you need to do something about that." And that person, then did indeed take care of that situation. But that would be an example of advocacy, abuse, and neglect. Client tells you that somebody has, exploited them or abused them. You need to immediately contact the authorities and make sure that they are protected, and that if they need follow-up services, that's all done, and that's part of, again, advocacy. Um, Persons with intellectual or developmental disabilities may need the support and advocacy to become effective self-advocates. So we also want to try to make sure that people become advocates for themselves, so that they understand what it's all about to be in the community and speak up for themselves and to do things independently. So we really want to try to help people to be more independent in their lives. Um, the goal of systems advocacy is to enhance public awareness of the rights, strengths, needs, and interests of people with intellectual or developmental disabilities, and to influence law and policy to improve public and private systems to support the individuals. So again, what are we doing to make things better for folks that we serve? So as an example, and we're going to talk about this a little bit more in a few minutes, um, there are public meetings that you can attend. Sometimes you on the web, sometimes in person, where you can give feedback as to how you think things should go. Tonight, for example, the current regional center is having a public meeting to talk about how purchase of services are spent based off of people's uh, race, ethnicity, language, etc. And there are some disparities, so that people of color, in many cases, are receiving less purchase of service dollars, so less is being spent on people of color than are being spent on Anglos. Now, why is that? Is that a cultural issue? Is there an inherent bias, so that people who are have disabilities and are of a racial minority are treated differently, or what it is. This is a hearing to talk about that and to sort of explain what the regional center has found over the last year and where those stats are now, the statistics in regards to the differences, and they're going to solicit input from the public about how they can make things better. So that would be an example of advocacy if you wanted to go to the meeting tonight, or it's also available on the website. So if you're interested, if you go to the Kern Regional Center website, you can find the web address or the address for Regional Center, and that's from 6 to 7:30 tonight. Service providers and self-advocates should play a meaningful role in systems change. So we want to change the system. So if one group of clients isn't receiving the same amount of services as another group of individuals, how do we change that so that everybody is receiving equal services? If those individuals who have mental health needs are not receiving the same services as some of the folks in the general population who have mental health needs because they're viewed as having regional center services, so they don't need mental health services. How do we change that? Because they're just as entitled to that level of service. Agencies providing support to individuals should also advocate for systems change that may improve the quality of life for individuals, whether it's supported by an agency or not. So we want to make sure that whether they're involved with your program or not involved in the program, that we're speaking up. Now, an example of that is tomorrow at 9:30 in the morning, the Senate Budget Committee, number 3, there are a number of budget committees related to different budget areas, but the area that's Health and Human Services is Senate 3. Um, on Health and Human Services is having an informational hearing on the Department of Developmental Services, the state agency that controls all the funds and makes all the rules that regional centers and you as a provider are really under. And then they also interpret the federal rules and create the state's policies on how those are going to be implemented. What are they going to be talking about tomorrow? They're going to be talking about purchase of services decreased last year. So what the governor proposed in his budget and what was spent, we spent less than what the governor thought we were going to spend. Why is that discrepancy occurring? Is it occurring because, on the one hand, we as providers can't find enough staff, and so maybe we're not taking new referrals and or developing new programs so that there's a waiting list for certain programs and people aren't getting into the services that they really want, or what are the reasons that we're not spending all the dollars that were set aside for the system last year? Um, the master plan, the Department of Developmental Services is now working on a sort of a long range plan of how developmental services should be provided in the future. Recently, a number of agencies came together and they developed a master plan for services for the elderly. And based on that same model, the Department of Developmental Services is looking at developing a master plan for services for people with developmental service needs. Um, Equity and oversight, I talked a little bit about that earlier, about how certain groups of individuals based on race, national origin, language, etc., may not be receiving the same amounts of purchase of service dollars as other groups. And is that a cultural issue that people of this certain group don't rely on public services and are more want to be self-reliant? Is it a matter of systematic discrimination so that groups are being treated differently? I mean, those are all potential that need to be addressed and looked at to really figure out what's causing this difference. And is that something that can be changed so that services are being provided equitably to all individuals? Many of you may know that 7 years ago, the Department of Developmental Services did a rate study to look at the rates that providers were receiving for the services that they were providing back in 2008, 2009, 2010, those 3 years when we were in the recession that occurred during that time. the state basically eliminated $1 billion from the system. And it's taken many years for us to get back to where we were. And but in the meantime, inflation and everything else has continued to uh, rise the cost of us doing business. So the state, through the legislative process and through advocacy and everything else, came up with a committee to, came up with funds, and then a private third-party individual, Burns and Associates, was hired to look at this and to come up with where rates should be. The Burns and Associates came up with a plan to put basically $2 billion, with a B, billion, in back into the system to make sure that the rates better reflected the cost of doing business. And over the last 4 years, that's some of the rate increases that you've been seeing have to do with the Burns and Associates study and DDS and the legislature's implementation. Well, the state's now looking at a deficit in terms of the amount of tax dollars that they receive versus what we want to see for services for this year, next year, and they think even the following year after that is what the projections currently are. So the governor has made certain proposals to uh, to get the budget back in line with what spending is, to get it so it's sort of like this. They want to get it back to this. One of those changes is to delay the final round of rate increases for providers. And that would be 1 year. And that would save about $1 billion for the state. So help the state get more into compliance with where the actual costs of doing business are. But the effect is that means that you've got to wait another year to get the rate increase that basically gets you back up to where you were or should have been 3 or 4 years ago. It doesn't even get you back up to today's rates. It just gets you back up to where when the study was done 3 or 4 years ago. So this is an area that will also be discussed tomorrow at the hearing. And should it be delayed, in the assembly, the lower chamber of California government, at their hearing recently, they decided no, they disagree with the governor, and they think that you all should get that raise July 1 and was as originally planned in the budget. Um, there will be discussions about the IPP meetings and how those are done and changes that can be made so that the meetings better reflect the needs and wants of the individuals that we serve and are more person-centered. And finally, a home and community-based waiver services spending plan that the Department of Developmental Services has and potential changes to that for next year. So all of that's going to be discussed tomorrow morning. Now it says 9:30. Oftentimes the chambers are meeting in the morning, and so hearings get started a little late. So sometimes it doesn't start on time. They're also going to be talking about the Department of Rehabilitation at tomorrow's hearing, and so the time isn't exactly 9:30. It could be a little changed and what have you. If you are interested in the viewing, participating, or making comments during or after the hearing, for tomorrow's hearing, if you're interested in viewing it, the legislature does not use Zoom or WebEx. Their hearings, but they use their own live streaming. And to view it, go to the Senate California website and look up calendar, and then scroll down to committee hearings, look at Senate Sub 3 Health and Welfare, and then click on Watch Hearing. And then later on, if you can't make it tomorrow, you can view the hearing at a later date. They do record it and put it on their website, so it's on the Senate Government Media Archive site. They For tomorrow's hearing, they're not taking public comments by phone. So if you're going to get on the hearing, you can listen, you can get the information of what they're talking about, so you can be more informed about helping to advocate for your facility or for the individuals you serve. But they are taking written comment, so you can make comment in writing. You can send it to your state senator and let them know that what's going on. For many of you, that would be Shannon Grove would be your state senator. Um, and then you can, if you happen to be in Sacramento tomorrow, you can go to the hearing and give your comments in person. So that's an example of advocacy at the system level. Um, there's also, on a regular basis, our legislature creates new laws, and these new laws then become the requirements of how you operate your facility and how you provide services to the people in your facility. Um, Here are just two of the bills that are currently being reviewed in the legislature. So this is the whole concept that I'm trying to address right now is to show you how this process works a little bit. So if you do want to get involved with trying to make system changes, here's how you go about it. So the first one is Assembly Bill 1914. Now, if you're interested at all, when there are bills in the California legislature, they start off with either AB or SB. AB are Assembly bills, SB are Senate bills. So, and that's the House where it was first introduced. So, a Senate bill that a senator said, I want to sponsor this piece of legislation, would have SB and then a four-digit number. A House bill, assembly bill, would have an AB. So here are two of the bills that are currently going through the legislation right as we speak. A certification program for direct service professionals. This bill would require the Chancellor of the California Community Colleges offices to develop a model curriculum for a certification program for providers of care to individuals with developmental disability designed to offer at a community college campus where sufficient student interest and properly qualified facility to sustain a certificate program. So this would mean that potentially Bakersfield College, Taft College, Porterville College, Sierra Cosa would offer classes so that either you or your staff could get a certificate from a community college that you are a professional direct service professional. Another bill that's currently looking at uh, moving through the legislative process is AB 2510. This would be a dental care for persons with developmental disabilities. So I'm sure many of you have had challenges with dental care for some of the individuals that you serve. And unfortunately, our the people that we offer services to have much worse dental outcomes than they do the general population. So you tend to see more cavities, more pulled teeth, more other dental appliances, root canals, all the other things that go along with dentistry. And in addition, many of the individuals who are especially tactile sensitive, they don't like to have people in their mouth. They don't like maybe the noise from the equipment. They don't like the Novocaine, etc. May need to have sedation where they're put under, which then creates a whole other issue. So this bill attempts to address some of that. So this bill would require the State Department of Developmental Services to contract with California North State University no later than, and the date hasn't been established yet, uh, to establish a statewide program centered in the state regional centers to improve the provision of dental care services to people with developmental disabilities, and specifically to prevent or reduce the need for dental services consumers to receive dental treatment using sedation and general anesthesia. So this bill, in its current form, would actually create dental clinics at Kern Regional Center and would allow for individuals who are served to go to these centers and receive services, and would try to find alternatives so that people who currently need to have their dental services under sedation or general anesthesia wouldn't necessarily need to do that. So if you think that's an important issue, this is something, again, that you can get involved with and let your legislators know, hey, we support this, or we don't think this is such a great idea. We have a good relationship with the dental services that we receive now. We don't really think this is necessary, et cetera. So you can take a position one way or the other and let your legislators know. Have any of you, and you can unmute your mic if you have, ever gone to a legislative office to talk to them about a specific issue related to developmental uh, disabilities, or have them come out to your facility and take a look and meet the individuals you serve so that they get a better understanding? Have any of you done that? Please open up your mic and share if you have. Okay, good. Go ahead.
I've only ever, hi, this is Tammy from Inclusion Films. I've only ever in Washington. I've never done it at the state capitol, but it's just essentially taking information about your program and talking to either whatever elected official or even their staff. But it's just putting your information out there and just
Uh-huh.
advocating.
Okay.
And but I've never actually had any politician follow up and actually come to our program.
Okay. Now, the regional, anybody else? A regional center has uh, yearly a program where they go up to Sacramento and meet with legislators on a given day. They call it grassroots days, meaning that, coming from the roots up to the people, the powers that be. And if you're interested in that, you can contact the regional center. And they've got a group going up, I believe, next month. There are a number of advocacy groups. Like, I contract now with the Bakersfield ARC. Bakersfield ARC it belongs to the California ARC, and they, along with a number of other groups, meet with legislators every year to talk about certain issues. The biggest issue, obviously, this year continues to be the governor's proposal to, push back the rate adjustment for 1 year. And that's become the main issue for this next year. But there are other issues. There are issues related to the fact that the funding levels to operate the regional centers are too low, and that regional centers have a difficult time attracting staff and keeping staff. So for those of you who have, over the last few years, seen a number of different coordinators coming out to your program, and they're here one time, the next time it's someone else. I just heard that about 2 weeks ago, our regional center was training 40 new coordinators. So, they're having turnover issues, and that means that the people that come out don't necessarily know what's going on in your program. Funding them adequately would mean more longevity for the staff and would be beneficial to the services that you provide. So that'd be another issue that people are advocating for currently. Self-advocacy and leadership. Now, self-advocacy is where we train or work with and educate the individuals that we serve on how to speak up for themselves. People with intellectual and developmental disabilities have the right to advocate and to be supported to act as self-advocates. Self-advocates exercise their right as citizens by communicating for and representing themselves and others with whatever support they need. So help them wherever. So, and yesterday we just had a special election. The week before we had a primary. How many of you had individuals in your facility who voted? And if they, and sitting down maybe with the individuals in your facility and talking about what the issues are and trying to find out what the different candidates think about that. So if there's one candidate that says, no, I think that we need to cut spending at all costs, and that it doesn't matter what type of service it is. I'm not in favor of spending more government. I think we should be getting less government. That would take on a very different approach to the services that we'd have than somebody who might feel like we should be fully supporting developmental services. So if the individuals know what the different candidates stand for, they can decide whether they feel like, okay, less government is better, more government or maintaining levels of services are what it's all about, then that's helpful. So that's part of self-advocacy too, is encouraging the clients that you serve to vote. Um, Self-advocacy must have a meaningful role in decision making in all areas of their daily lives and public policy decisions that support folks. Now, one of the things that you've got to think about as well is, just like there are whistleblower policies at the regional center, at the state level, at federal levels, this is an area too that as people speak up, uh, they shouldn't be retaliated against. And the example that I heard recently was a individual who was living in a residential facility, shared with a family member uh, a problem that was occurring in the facility. That person then contacted the regional center. The regional center then went out, did their investigation, and the next time that family member came out to the facility, um, the individual who lived there said, "I got into trouble for speaking up." Now that's retaliation. The individual, if they see something they don't like, has a right to share with others, and we need to respect that. And if somebody says something and it then creates an investigation, and that investigation finds that there really was a problem, or if they find that there wasn't a problem. And if there wasn't a problem, then working with that individual on maybe their understanding of what really occurred can make a change. But we want to make sure that there is no retaliation at any time for individuals for the services they receive. Um, Again, the different types of advocacy you can do, political advocacy, uh, supporting one group, one party, one philosophy in terms of services is another area. Do you think we should be more services, less services? There was an article in last week's LA Times one day about developmental services in Kansas. And in Kansas, like a number of other states, there's a waiting list. So if you want services for your adult son or daughter in that state, you sign them up when they're like a preteen. So by the time they get to be an adult, they'll be able to get services because that's how long you have to wait to get services. Nationwide, there are about 700,000 uh, persons with intellectual and developmental disabilities who are not receiving services because that state doesn't provide services beyond their capped level of service. California says anybody walking in the door who has a developmental disability, so walks in the door regional center, gets an assessment, is found eligible, gets an IPP, and with that IPP, the services and supports they need. Is that sustainable? Can California continue to do that? Right now, the entitlement is pretty locked in. But what would happen, let's say, over the next few years if the budget situation continues to be difficult? I mean, the governor has said that he wants to take $1 billion and delay it for a year so that the increases that you're supposed to get on July 1 will be July 1 of 2025. What if he comes back and says, no, we need to take even more? So that's why you want to really, and so that's also why you want to advocate for funding to make sure that you are adequately compensated. In addition, advocating for the clients, the people that we serve, um, there has been some exceptions made in terms of like an able account or special needs trusts or whatever, but really they can't have more than $2,000 in assets, or they can be cut off of SSI, Social Security Disability Insurance, and the California Medi-Cal. That $2,000 limit on savings went into effect in the early 1970s. So that hasn't raised since the 1970s. Now, in the 1970s, $2,000. I bought a brand new car in 1977 and I paid $5,000 for it. Go out and try to find a new car for $5,000 today. It hasn't changed. there needs to be advocacy to allow individuals served to have a better amount of savings if they so choose to do that, or the rates that people receive. I just recently saw an article that said people on disability in California can't afford housing, can't even afford rent, and even here in Bakersfield where the costs are lower. So again, advocacy on behalf of individuals is important. Um, the challenges to advocacy. What um, people with intellectual and service providers need resources which will educate and empower them to bring about change. So if you want to be a change maker, you need to know what you're talking about and how to go about making changes. And so understanding things. So, for example, those two bills that I mentioned earlier, the one about the DSP certification and also about the dental services, if you want more information about those, you can go online and type in California legislation AB and then put in the number, and up will pop the bill. And you can read the bill if you would like, if you, especially if you want to have a better understanding of what it's all about, you can see it and decide for yourself. Is this something that I support? Um, People with intellectual and developmental disabilities and their service providers need to have the backing and success to navigate the system. Now, for years, I've heard that some people are concerned that if they speak up, they will somehow be blacklisted. That they won't receive any new referrals. They won't, they won't receive some of the rate adjustments they've been requesting. Other situations, they might have an evaluation. All of a sudden, a surprise evaluation. I've never found that to be the case, but you do want to be able to be successful to navigate through the system and be able to do what you're really attempting to accomplish. Advocates who need support should be able to get support they need, including education and assistance. So this is where you really can help the individuals that you serve. So, for example, as we mentioned earlier about registering and voting, sitting down with the people, there is a packet that comes in the mail along with the ballot that explains people's positions on government, how they would govern if they were elected. Also, for any propositions, there are some propositions on the ballots. There was one that we voted on last week that had to do with some of how mental health money is going to be spent in the future, and some bonds, and specifically uh, addressing homeless. Now, there are not many, but there are some homeless intellectual and developmentally disabled people in California that aren't necessarily part of the regional center system, or are, but for some reason are homeless, and that would address them as well as other folks. How did you vote on that? Or did you vote? That could be an advocacy issue for the people we serve. And advocates should not be retaliated against for their advocacy. As I mentioned earlier, the individual who spoke up with their family. Also, if you go to a public meeting, so let's say you go to the meeting this evening on racial and ethnic disparity and equity in services, and you were to speak up and say you don't feel that it's being uh, done correctly, the regional center should not in any way form um, to retaliate against you or your facility. So those are pretty clear in the law too. So you are protected for doing advocacy work. Okay, it is 10:56. And I'd like to open it up for the last 4 minutes to any questions, concerns, comments. This is uh, a lot this morning. It's not direct services that you provide, but it really does pertain to direct services, because why we do much of what we do is because it's in the law or a regulation or policies. And so being a person who speaks up in regards to wait a minute, why is that policy there? Does this make sense? Should this be changed? Is there a better way of doing things? This is where advocacy comes in, both for the people that you serve and for your facility as well. Questions, comments, concerns? Just open up your mic and speak up. Okay, I just put up on the screen, these are some of the laws both at the federal and the state level. At the federal level, you have the Americans with Disabilities Act, which specifically states certain laws regards to the rights of people with disability, including such things as accessibility. So when you see curb cuts and ramps and other things so that people can get into facilities and buildings. That has to do with the Americans with Disability Act, the Rehab Act, which has to do with some of the way services are provided at the national and state level. Individuals with Disabilities Education Act is for children ages 3 to 22 and how they receive public education. When I was a youngster, if there was any public education at all for people with disability, it was in that little bungalow way off in the back of the campus. And so that's changed. And then finally, the Lanterman Act. Frank Lanterman was a legislator back in the 1960s who was responsible for creating the regional center system as we know it today. And so, in tribute to his excellent work on advocacy for the persons that we serve, they named the act after him. So it's the Welfare and Institutions Code, section 4500, but it's known as the Lanterman Act. So if you hear, okay, well, somebody from the regional center comes out and says, well, that's in the Lanterman Act. Well, that's what the Lanterman Act is. And if you want to look at the Lanterman Act, if you go to dds.ca.gov, and you'll get to that page and you look at you can go down and scroll down the page and you'll see legislation, and click on that and it'll take you to the Lanterman Act, and if you and it includes a search function. So if you have a specific issue that you want to look for, you can do that and you can get information about the California law. You can also from that website get to Title 17, which is the section of the California Code of Administration regulation that pertains specifically to the services that we provide under the Department of Developmental Services. Okay, one last call for questions or concerns or comments. Well, thank you for coming on today. Next week, we will be having a webinar specifically on individual program plans. We had one last month, and for some reason, because of technical difficulties, I got cut off after 58 minutes, and it was supposed to be an hour and a half. So we'll go over the slides that were in the last 30 minutes, and then there'll be some additional slides. So that'll be on person-centered planning and individual program plans. And then on that's 27th, and then on the 28th, there is the CQL webinar as well. So there's a lot of educational opportunities available to you if you would like to do that. And I would strongly encourage you to, depending on your time. So with that, I will say goodbye and have a good rest of the day and a good rest of the week, and look forward to seeing you in the future.
Thank you, Jeff.
Thank you.